DRPLA is a very painful disease that causes brain atrophy. It's genetic and progressive, but it is not well known and support is lacking. We want more people to know about this disease, so we decided to share our story. Some names and details have been changed. We hope DRPLA become widely known and a cure is found and fewer patients and families suffer. In the case of Miss D, my family has 5 members, my husband and our 3 daughters. My husband and 2 of our daughters have DRPLA. Both daughters are already married. We don't know the exact age when the symptoms started, but we think my husband showed signs in his 40s or 50s, and our daughters in their 20s. The hardest part of this illness was my husband's change in personality. He couldn't control his emotions anymore, especially anger. He would yell in a loud voice, get very angry, and break things, even over small things or for no clear reason. He liked drinking alcohol, but when he drank, his anger got even worse. Because he couldn't control his feelings, he would get angry in public place too, staring at people, shouting loudly, or even yelling over the phone. Even if I tried to stop him, he wouldn't stop. Sometimes it made him even angrier. I knew it was the disease. He's my husband, but he's big and strong, and when he was angry, he was very scary. Maybe because of that, loud sounds or voices started making my heart beat fast. I couldn't calm down. In the past, my husband was never like that. He didn't shout. He didn't get angry at anyone. On holidays, he often played with our kids at the park or in the pool. In his 50s, he changed jobs many times and finally settled in a job for people with disabilities. Looking back, I think maybe he couldn't manage his work anymore because of the illness. He also started working unsteadily. Some people thought he was drunk. Now, compared to before, his anger and violent actions have become less. But he needs more support in daily life, and when going out, he falls more often. He even broke a bone once. For our 2 daughters, the first sign of illness was seizures with stiffness, something my husband never had. Under their 20s, they are living normally, but they had trouble keeping jobs. They changed jobs many times. Now I think maybe their brain had slowly started having trouble remembering things. Then they started to have strong balance problems. They couldn't carry things while walking. They had to stop walking. Now, both my husband and daughters can hardly walk. They use wheelchairs more often. Even small daily tasks are difficult for them. It's hard to understand their speech. They also have trouble swallowing. We now need to thicken their drinks. My husband says, I don't care about myself. I just want medicine to come in time for our daughters. That makes me very sad. My daughters are living with support from their husbands, but the disease is getting worse. They need help and watching all the time, for working, for daily life, for everything. The younger daughter is finding it harder to raise her child. Because of the disease, her child is starting to understand more than the mother. My daughter sometimes gets angry for no clear reason and argues with her child. I'm very worried about how this affects the child's mental health. Genetic diseases happen inside families. Statistics show the number of patients, but they don't show that 3 people in one family can get sick. It's very hard when one person has to care for 3 family members. And we always carry fear that a child who is not sick yet might get the disease someday. What's even harder is this. Even though they have the same illness, our daughters are worse than my husband. They have seizures. Their symptoms are more serious and get worse faster. They lose abilities they used to have. They can't understand things. Their personality changes. DRPLA is a progressive disease. There is no treatment. We cannot stop it. I can only watch as our family members slowly change over many years. The sadness and pain never gets easier. On top of that, the money problems become bigger and bigger. I want the medicine to come soon, in time for my family. If there is hope, if there is a trial drug, I want them to get it now. I don't want to just wait while they get worse.